Hey guys, in this video I'm going to go over some exercises you can do if you're experiencing low back tightness or if you're going through any current low back injuries. So first one, we're going to be on the ground here. We're going to bring our knees a bit wider than hip width apart. And we're going to point our feet in together and we're just going to sit back into child's pose. And we're going to sit here for roughly 30 seconds. And really try your best to sit back on the heels, reach your hands out as much as you can. That way you're getting a full stretch all the way down. And just let your head rest. After those 30 seconds, we're going to walk our hands to one side, open up, breathe into that side. We're going to hold here for 30 seconds. Again, just trying to relax into this pose as best you can. And after 30 seconds on this side, we're going to go all the way over to the other side and sink into that side as well. And really try to breathe into this side of the body and feel the stretch all the way through. Next, what we got, we're going to go onto our stomach. So this one can be called cobra, can be called sloppy push-ups, both kind of interchangeable. But what we're going to do is we're going to put our hands underneath our shoulders, and we're going to just come up to here, and then we're going to go back down. All the way, relax, going back up. And back down. And we got 10 of these. And if coming all the way up to here is a little too much, you're getting some pain with that, then what we can do is we can use our elbows and just coming up to here and back down. Coming up, back down. Okay, but if you can, hands out, coming back up. And about 10 of these. So this one is just good because we spend a lot of the days, forward flex, whether we're sitting at a table, whether we're sitting at our computer, we're constantly flexed forward, especially through our low back, through everything just forward. So a lot of time when you have low back pain, if you introduce some extension, which is what we do with that exercise, that'll actually help relieve some of the pain that you're having in your low back, just because you're getting that movement and taking a little bit of stress off those vertebrae. So staying on the ground, staying on our stomachs, we're now going to put our hands out to the side, and we're going to do what I call scorpion. So we're going to pick up opposite foot, come up towards that hand as far as you can go, and then come back, and then we're going to go other side, back. If you can't get your foot to your hand, that's okay. Just again, like I said, just reach to where you can. Focus on getting that full movement, not trying to rush through this. And we get to have about 10 per side here. And there should be no pain with this. If there's pain, try to just decrease your range of motion a little bit. So if you can't get your foot all the way up here, if you have to keep your foot down here and then come back, we just want to work within a pain-free range of motion. Okay, so after 10 of those, hopping on our back. So these are going to be basically the same thing, but now we're on our back. Vertebrae are just moving a bit differently, getting a different range of motion with this one. So hands go out to the side, and we're going to go up and over. Up and over. And we got 10 of these as well. Again, big thing with this one, just try not to rush through it. Try to take your time, really work through the range, and be nice and controlled. Okay, so we got 10 of these, both sides. And try our best to keep our hands flat on the ground. Again, if we're experiencing some pain with this one, we can decrease the range of motion by not reaching as far up with our leg, but still trying to get some of that rotation through the lower back. Okay? But if you can, come up, let that leg cross, bring it back, up, cross, bring it back. Okay? For our next ones, we're going to be here in this position. Knees about hip width apart, feet hip width apart, kind of underneath our knees. What we're going to do is we're going to lift our hips, shift them over to one side, and then we're going to let our legs fall here. Okay? Have your other hand stretched out. You can use this one if you want to pull a little bit of gravity, a little bit of pressure, get more of a stretch, and you're going to feel a stretch through the opposite side of your low back. And we're going to hold here for 30 seconds. This one too, if you're getting pain with your knees being stacked, you can stagger them, take a little bit of pressure off your low back. To get more, you're going to stack them a bit more. And try to breathe into this side of your body, getting nice stretch through those muscles. Okay, and then after 30 seconds, we're going to slowly bring ourselves back up. Then we're going to bring our hips to the other side, drop them down. Opposite hand stays stretched out. And just sink into this stretch here. Another thing you can do if you're having some problems with your knees being this far is you can get a little bit of a little pillow or something, put it underneath your lower knee, and that's just going to raise you up a little bit so you're not as twisted. But you can get to a spot where you feel a stretch but with no pain, and you can just work in there and then build to the point where you can just drop both knees. Again, just breathing into this side of your body, feel it expand and open up and get some good stretching in there. And when we get out of these exercises, we do want to be cautious of our back. You don't want to just be done and then just get up as fast as possible. You want to make sure we're engaging our core and we're slowly coming back up to our normal position. Because sometimes if you go too fast and you're in those kind of twisted positions, you can injure yourself. I know it doesn't seem likely, and I know, you know, it's hard to believe, but a lot of people have done it before, and a lot of people still do it. So our last exercise, we're going to be standing for this one. So for this one, we're just going to find a wall. What we're going to do to start, we're going to go shoulder right against the wall. Our body's square, facing forward, and all we're going to do is drop our hip down and then back up. We go hip down towards the wall, back up. We got 10 of these. Now for these ones, a lot of the time when you're first starting it, it'll feel really tight on that side and that low back. Usually the first few will be tight, but as you keep going, it will loosen up and you won't feel as much tension. Now, if this is too easy, you're not really getting anything with your shoulder right against the wall, we can go shoulder out, same things, and then just drop. And this just allows for a greater stretch. So sometimes what I like to do is I'll do my first set with my shoulder right against the wall, loosen things up a little bit, and then I'll do a couple more sets at this that allows me to just get a little bit more range of motion and really dip into that, open up that low back, and come back up. Okay, after 10 on that side, we'll flip to the other side. So I'll start with my shoulder against the wall again. Drop and hip down and up. Okay, not too easy. We'll go to elbow on the wall. Get a little bit more range there, keeping everything square and pointing forward, trying not to twist our body either way, keeping everything nice and square. So that's the video for the low back. Like I said, these are just good if you're someone that, you know, you're feeling some low back tightness, or if you're someone with a history of low back injuries. These are just great exercises to do to, you know, just get some movement back in there, especially if you're sitting for a long time, it feels stiff. You know, it's a good idea for doing that before you get into any athletic movements, whether it's your sports or a workout or anything like that. I would recommend doing these first. Get things loosened up in your back. That way you're just not at risk for it. With these exercises, I would do, you know, at least 3 sets of them all the way through. They don't take very long, they're pretty quick. So 3 sets shouldn't be too hard for you to do before any of your activities.